I bring you very loving greetings from the new medical center Pondicherry. I am Dr Ashok Kumar Das. I am the former Dean and Medical Superintendent of JIPMER and former Professor and Head of Endocrinology, Metabolism, Diabetes at JIPMER and PIMS. Now I am working at the new medical center. Today I am very delighted to talk to you about a very common disease. Evola common is 1/4 of the population, 25% Noorlende have this disease, and we call it diabetes mellitus or Shakarvedi. Dear friends, this disease has become an epidemic, or we call it a tsunamic disease, tsunamic proportion disease, and there is no chance of it receding. It is becoming more and more and more. And diabetes today, with all its comorbidities, comorbid artha, its various complications, its complication hrudayale, kalle, kidneyle, in the eyes has become a great malady for the human being. So dear friends, I am going to discuss very briefly, both in English and also in the colloquial language, what is diabetes very briefly. The next agenda of my talk, can we halt, not only halt, can we reverse, can we go back to the normal physiology, normal state of the body despite diabetes. We call it having a delightful, decent life despite diabetes. Today it is possible. We can have a perfect, normal life despite diabetes, and also we can reverse the diabetes. We can have blood sugar both fasting, sapartha munade, sapartha apron, any time of the day, diabetes properly controlled, and we can win over by our effort, by the cooperation of the doctors and heeding to their advice, we can totally reverse the complications in the various organs of the body. At the same time, I must tell you, if not reverse, if we cannot totally prevent, we can postpone for 20 years, 30 years, 40 years these complications in the various organs. So dear friends, my agenda today is to let you know how do we control our diabetes very easily, very simply, with the available drugs which is very affordable. How do we maximize the benefits of diabetes treatment and reap the consequences as a totally complication-free, diabetes-free life in spite of having diabetes sometime in our life. Dear friends, diabetes means a disease of blood sugar. Even though it is said blood sugar, edile protein, kolupu, vitamins, everything gets affected. It is a disease of the carbohydrate, fat, protein and other trace elements. Therefore, today the concept number one is that we have to treat diabetes as a holistic manner. That means diabetes is no more today in 2022 is centered around only glucose. We are no more what we call quote unquote glucocentric. We concentrate on the integral management, total management, Purnam management of the person with diabetes. We no more use the word diabetic. That is a very misnomer. We call it persons with diabetes because it's so common, so common. So how can we do that? How can we prevent? If not prevent, postpone the diabetic complications and can have a normal life, delightful, decent life despite diabetes. At the beginning, I'll tell you a few things which is very important to remember. Number one, WHO, World Health Organization, sometime back said that a known and controlled diabetes is better than a non-diabetic. உங்களுக்கு சக்கரவதி இருக்கே, உங்களுக்கு சக்கரவதி control இருக்கே, your health is much better than a person யாருக்கு சக்கரவதி கிடையாது. ஏன் இப்படி? ஏன்னா உங்களுக்கு சக்கரவதி இருக்கேன்னா அடிக்கடி நீங்கள் டாக்டர் பார்த்து blood sugar பார்த்து blood கொழுப்பு பார்த்து urea creatine kidney எப்படி function பண்ணுது and timely you take x-ray, timely you take ECG, you have proper what we call in our language monitoring. That means you monitor your body, like you monitor the class, like you monitor a session, you monitor your whole body by looking at the various aspects, and whenever anything goes little bit wrong, you take steps with the help of your doctor or even yourself to set it right. Second point I like to mention that today diabetes is not a disease. I was in a meeting in Bangalore about a few years back, and His Excellency Abdul Kalamji was there, and I was sitting next to him. When he heard the deliberations, he asked a very important question. He said, Dr. Das, is it diabetes a disease or a syndrome? A syndrome means totipotential, universally present, everywhere present. I said, sir, you rightly said, sir, it is a syndrome. Means that diabetes affects head to toe, hair to the nail. It affects mainly 5 organs, which I will speak about today. One, the eyes. If you take out cataract, the cataracts minus portana, the most important cause of preventable blindness. This means the blindness which you can totally prevent is diabetes. Number 2, it affects the heart. உங்களுக்கு நான் இது மெசேஜ் கொடுத்து முடியும் कि 100 75%, 3/4 of the diabetics die of the heart disease. Therefore, sometime back in 2004, it was told that diabetes is a equivalent to heart disease because 75%, 3/4 of all diabetics die because of heart attacks. We'll discuss how to prevent it. Third, most important, is the kidney disease. Today, of late in 2022, diabetic kidney disease has become very, very important. Like kidney failure, diabetic kidney disease with uremia, with people undergoing dialysis, people undergoing kidney transplantation, rambu common age. Yeah. If you go to a transplant program, you will find number 1 cause of transplant in the country is diabetic kidney. Number 1 cause for the dialysis is diabetes. It is extremely common. Fourth one is the diabetic foot disease. நீங்கள் நிறைய பேர் பார்த்து அதுக்கு leg has been amputated. Leg has been cut. Now, if you take out the road traffic accidents, we call it RTA. The next important cause for lower limb, that is ಕಾಲ್ ಆಂಪುಟೇಷನ್ ಪೋಡ್ತಕ್ಕೆ ಮುಖ್ಯಮ ಕಾರಣಂ diabetes. So diabetic foot is a very severe complications where you have to pay the price by some time. If you are careful, you can definitely save your leg. I'll tell you the tips how you can save your leg. But if one is not careful, I'm sure you are all careful, you are listening to this talk, you can all save your feet. Therefore, I told you eyes, heart, kidney and feet. And finally, it is the nerves. நிறைய பேர்த்துக்கு சக்கரவர்த்தி இருக்கு, உங்களுக்கு காலில் மரமரமாக இருக்கு, காலில் சென்சேஷன் கிடையாது. ரோடில் போய் டைமில் கால் எப்படி மாதிரி உங்களுக்கு இல்லை கிராஸ் மேலே இருக்க மாதிரி தெரியும், உங்களுக்கு கீழே என்ன இருக்க தெரியாது. சம்டைம்ஸ் you sometimes have in your shoes small pins, small children's toys. காலில் சென்சேஷன் கிடையாது, ஸோ உங்களுக்கு தெரியாது கால் கீழே என்ன இருக்கு. உங்களுக்கு காலில் புண்ணு வந்தாச்சுன்னா I had a patient day for yesterday. இதில் he was traveling in a motorbike. He had severe diabetes and his leg and feet has come in contact with the silencer. Silencer evla temperature it was very hot. He never perceived that the temperature in the silencer. By the time he arrived in his house, he found that it is totally, there's a great blister in the feet. So these are the 5 things we must take care. Therefore, we come back to the methods. How do we prevent? How do we reverse? How do we postpone? How do we become normal despite diabetes? Number 1, please remember, diabetes management is just like a table. I'm sitting in front of a table. The table has evla leg irke table ke 4 leg irke. Diabetes management ke eppadi mari 4 weapon irke. four legs of the table. Number one leg is about the diet. Very important. What to eat, what not to eat. I'll have a special session, and NMC Sundaram sir will have a special session on the diet that I'll take shortly. The second one is exercise. One must exercise. Diabetes is a disease of inactivity. Diabetes is a disease of what we call sedentarism. If you sit for more than half an hour without doing any work, it is like smoking 4 cigarettes. Today's culture, like sitting in front of the television, not walking around. You can never forget to carry your legs. We always give excuses. Innike rambu sudirike, innike malirike, innike pomudiyade, neriya vedirike. These are all false excuses. Despite everything, I'll request all persons with diabetes to walk. If they have any heart disease, any problem, they should consult their doctor and ask whether they can do exercise or not. They should walk at least 45 minutes. At least 45 minutes, 7 days a week. If you miss 1 day a week, it is acceptable. But we aim at 7 days a week. Now that is about exercise. The third leg is the tablets. Believe me, insulin is not a must for diabetes management, the type of diabetes I'm talking about management. Why? Because 90% or at least 87% of the diabetics can be very well controlled by the tablets we have in our armamentarium. Ungalku kaile anti-diabetes tablet irike, very good tablets, very affordable tablets. You can control diabetes by tablets. Not only you control diabetes, as I told you some time back, we control also the fat. We take away the fat. We also control the heart disease. How do we control? We have 2 tablets which we give for keeping the blood thin. If the blood is thin, it does not clot. If it does not clot, there is no heart attack. So wherever needed, doctors will give you this tablet, 2 tablets, which are very simple, very affordable, which can prevent the heart attack. So that is the tablets. We have also tablets for increasing blood flow in the feet. We have oral tablets to reduce the tingling, numbness, neuropathy in the feet. And the fourth leg, dear friends, is of course the insulin. So diet, exercise, oral tablets and insulin are the 4 legs of this table. But dear friends, tell me, the naal kaal irikana table complete irike? Table is not complete. We need a tabletop. This is a tabletop on front of which I am speaking. So what is the tabletop we need? This tabletop is the diabetes education. So dear friends, I would like to impress on you, Mukhyama is to know everything about diabetes. And NMC will be organizing many talks, camps, programs, and will know everything about diabetes. Dear friends, what is diabetes education? Today it is known a diabetic who knows most about diabetes. Eppudu mari person with diabetes, yarike diabetes sambandhama alla gyanam irikina, he lives longest. He lives longest. A diabetic who knows most about diabetes, he lives longest. We know we tell them what to eat, what not to eat, how to conduct himself, how to eat in a restaurant, how to eat in the house, how to fast, and now Ramjan has come. How to fast, how to feast. Number 2, how do you take care of your eyes, take care of your feet, take care of your heart? What are the heart-friendly diet? What are the kidney-friendly diet? What to do, what not to do? Most important, I will tell you, in spite of appearing a little rough and tough, we must remember that we are also here not to accept any myth. Dear friends, I have seen small children with diabetes. We call it type 1 diabetes. It is a chronic disease, and in our country, people who have chronic disease are exploited. They are exploited by people who are not qualified. They told the child, you did not take insulin. I will cure you with some herbs. I don't deny it. There are good system existing in our country, in the various other philosophies of medicine, in Ayurveda, Unani, Siddha. There are good medicines. But one must know what one is doing. This particular boy fell to the myth that he has to stop insulin and can be cured by some other things he was given. Lo and behold, you know what happened? The child landed up with a diabetic ketoacidosis. That means sugars were 700, 650. He became unconscious, but good thing he came in time and the child could be revived. So I am telling there are good things in every system. You can accept that, but under the supervision of the doctor, the primary doctor who is treating you. Therefore, one of the jobs of the diabetes education to displace, to remove the myth. Myth is the opposite of truth. To remove the myth that is going on in society. There are some people who say don't take insulin, insulin is bad. Some people say don't treat diabetes, diabetes is bad. I'll tell you a small story and then I'll tell the last part of my talk. You know, there were two American presidents. One president died because of tuberculosis in 1941. He died because that time anti-TB drugs were not in the market. It came in 1944-45. So that was acceptable. But one American president died because of high blood pressure. And there were two pundits, two hypertension experts. They were debating in 1942-43 whether hypertension treated or not to be treated. You are a laborer, you have a low blood pressure. Somebody is a minister, he should have a high blood pressure because he's doing a lot of high work. That was a myth. They did not treat this president for high blood pressure and he died of cerebral hemorrhage. Similar thing I would like to implead. I'm appealing to you. I'm giving my very brotherly, very affectionate advice to you that not taking care of your diabetes. You can take care any way you like. One is lifestyle, that is number one, number two, number three, then only everything comes. Do lifestyle, do control your diet, do control the exercise, sleep well. I have got 5 mantras. Eat well, eat appropriate. Don't eat too much, don't eat too little. If you go to a doctor, your dietitian, they will tell you what to eat, what not to eat. Number 2, walk more. Dear friends, my advice is walk more. Today's civilization has become a sedentarianism. We sit down. I have seen photographs. People have these machines where they can, the treadmills where they want to do exercise. I am not able to today show any photograph. Next time I'll show you. You will find the gentleman who is very fat is sitting in an armchair near the treadmill and his dog is on the treadmill doing the walking. He is watching the TV with the bottles of cold drink, chips and all types of bad food that increases diabetes. So I want to tell you lifestyle is number 1. So eat less or eat appropriate, work more and sleep well. Dear friend, it is very important for a diabetic to have what we call sleep hygiene. Like we have mental hygiene, we have physical hygiene, we have a sleep hygiene. You must have 8 hours of absolutely good sleep every day. So sleep hygiene. You know what is the last one? Keep smiling. That means stress free. So eat well, eat appropriate, work more, do exercise. Number 3, sleep well and keep smiling. They're the 4 mantras, what we call lifestyle. So lifestyle is a must, and at every stage of the disease, for everybody with diabetes, every person with diabetes, this lifestyle adherence is of paramount importance. The second thing is that I told you about the tablets and the insulin. So I'll go back to what I was saying you, that if you have diabetes, then you must remember that not taking care of your diabetes is deadly. Like the American president who did not take treatment for the hypertension. So my appeal to you, please remember, diabetes may not, you may say, we will tell you, is diabetes curable? If the doctor going to cure diabetes? Dear friend, you tell answer yes. I do not know what is cure, what is reversal. But today exist in the armamentarium drugs, agents, body irrigate to control your diabetes absolute normal level. Dear friends, what are the tips by which we reverse and keep the complications away? 3 principles. Number 1, control your blood glucose early. I'll repeat again. Control your blood glucose early. If you control the blood glucose in the beginning for first 1 year, 2 years, 3 years, even after 2 years, 3 years, the blood glucose becomes little high, the results are not that bad. But if the early on for first 3 years, 5 years, you have not controlled your blood glucose early, even if you control very strictly after 6 years, 7 years, there will be some benefit, no doubt about it, but you will not get the complete benefit. If you want to reverse diabetes, your objective must be early control of diabetes. There is a new research which has shown that first year of diabetes control. Supposing I am diagnosed diabetes today, 2022, April 5th, April 6th. So if my blood sugar is controlled very well from today to this date in 1923, I will have a better life than if I neglect and start controlling in 2030 after 8 years. So please remember, early control of blood glucose is paramount important. It has been said the first year diabetes control is very, very beneficial. So that is the first message I must tell you. Why this is? There are two things which evidence research has shown. One is called legacy effect. Legacy means, legacy. We are carrying on the legacy of our freedom fighters. We are carrying on the legacy of our forefathers. Each one of us carry the legacy of our parents. My parents was absolutely good. They were fabulous. They loved their children. They sacrificed. We are carrying the legacy. We are doing the same thing for our children, for our family. So legacy, that's called legacy effect. Number two, it is called metabolic memory. That means if you control blood glucose early, this gets into your metabolic memory. I told you, metabolism means the glucose control, lipid control, fat control, protein control, complication control. So it gets into metabolic memory. And even if later on the blood sugar goes topsy-turvy, I won't say it does not matter. It is minimal. The effect is very minimal on your health. So to reverse diabetes, the first principle is to diabetes control early. Second principle, that if you control diabetes early, you go into a stage what we call quote unquote honeymoon. Honeymoon is a very, those of you who are married, have undergone honeymoon, it's a very pleasant phase. Why do we call it honeymoon phase? Because diabetes disappears. I don't know how long ordinary honeymoon lasts, but this honeymoon can last for a long time, for 4 years, 5 years, 6 years. There are instances in the diabetic patient who have taken insulin early, but they are young people who are very high blood glucose. If they take treatment early, whether it is tablet, whether it is lifestyle, whether it is insulin, and control the diabetes effectively, they can go into total reversal. Believe me, I can show you any number of instances from my own patients and from the literature that the diabetes becomes controlled, and this control, even if they stop insulin, even if they stop the tablets, remains same for a very long time, that we call reversal of diabetes. Therefore, the third message is early. I will use one word which we use, but it's not a good word, early aggressive or early all-out control. We call it aggressive control. That means we make all our effort to control diabetes early, and that is very important. Whether it is tablet, whether it is insulin, whether it is lifestyle, or combined together, we have to control diabetes early. Fourth important thing, we have to take care to control the fat. How do you control the fat? We have to burn our fat. How do you burn our fat? By walking, by exercise. We had one guru of diabetes called Jocelyn, and in the World Jocelyn Clinic, I went there. Jocelyn Clinic in the United States is our Makkah of diabetes learning. He said, with an excess of fat, diabetes begins. With an excess of fat, diabetes dies. That means if you find a child whom you call chubby, the child ramunalla irukke, chubby irukke, fat irukke, if you lose weight, your mother will say, weight evla korunjaichi, neenga saapilla sariya. So it is the having fat in the body beyond what you require is bad. Diabetes occurs very often with the fat people. You know that Fat people get diabetes more often than the lean and thin people. So we have coined a term, diabetes and obesity. We call it diabesity. Diabesity is a great curse of the modern society. Therefore, if you take drugs for the diabesity, it is good, but one can control diabesity primarily by walking, primarily by exercise. Of course, one can take recourse to dieting when it is necessary. One can take recourse to drugs to bring down your obesity and your cholesterol. Dear friends, there are 4 elements in this fat. LDL, there is good cholesterol, good fat and bad fat. Good fat is the HDL. Bad fat is the LDL and triglyceride. You remember these 3 things, HDL, LDL and TG, triglyceride. If you have this good fat, that is HDL, it is good for your heart, kidney and the body, and it can only go up by exercise. If you will control your diabetes, triglyceride can come down, maintain it around below 150. LDL, you can bring it down below 100. I can guarantee if you have proper blood glucose control, you have the cholesterol levels as per the description advised, your heart is protected. 5th important thing I would like to tell you, that to control your kidneys, there are ways today. What are the ways to control kidney? I told you that diabetes is a disease. We have a saying for that. We take it to, in the schools and colleges, I go and talk about diabetes. Very important, 7th class onwards we talk to them. Why we talk to them? Because diabetes can be prevented by knowledge. That's why NMC has organized this talk. We say that diabetes is a sweet disease, Rambu Madhuraman disease, but it has sour company. The companies it has are very bad. What are the companies of this sweet disease? Heart disease, kidney disease, blood pressure, leg amputation, obesity, and and you say fatigue, you become very fatigued. I must tell you one thing. There is a new word we have coined today. Why do you live? Because you want to be happy. Why do we work? To become happy. Why do you get married, have children, have family? To be happy. But there is a term called glycemic happiness. If your sugars are high, I can guarantee you, try tomorrow morning and see. You are always drowsy, you are always under the weather, you feel you are not able to work if the sugars are appropriate. What is the appropriate level of sugar? It's about 100. If it is 100 fasting or 90 fasting and it is well controlled. That's called glycemic happiness. You are very happy if your blood sugars are normal. If the sugars are low, it is very bad. You are sweating, you get rapid heart rate, you sometimes can become unconscious. We call it hypoglycemia. Therefore, 2 things we always aim at: not to gain weight, at the same time not to produce low sugar. Please remember, having low sugar is very bad compared to high sugar. I'll implore all of you who have diabetes, who are on treatment, to have some candy, one chocolate, some kalakandi in your pocket. When you feel that sugars are coming down, you must take one. So you have to keep this sugar normal, at the same time keep the other elements normal. So when you talk about the full diabetes management, you have to control blood pressure optimally. My dear friends, my brothers and sisters, I will tell you one thing which is the truth. Controlling blood pressure is more important in diabetic than controlling blood glucose. Am I clear? I'll repeat again. Controlling blood pressure is more important than controlling blood glucose, because the heart complications, the kidney complications, and the most important, the stroke, paralysis. There are few people in diabetics and hypertensives who get a stroke, cerebral stroke. That means suddenly they will find that one side of the body does not move. I'm not scaring you, but you must have seen that diabetes can produce stroke. Stroke means paralysis. This occurs if the blood pressure is not controlled. Sugar also important, but blood pressure more important. So today in a diabetic, the blood pressure must be controlled. And believe me, my dear friends, in the blood pressure control, there are drugs. We have given 2 names to them. They are cardioprotective and renoprotective. What is cardioprotective? ಇದರಲ್ಲಿ ಹಾರ್ಟ್ಗೆ ಪ್ರೊಟೆಕ್ಟ್ ಕೊಡ್ತೆ ದ ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಓನ್ಲಿ ಬ್ಲಡ್ ಪ್ರೆಷರ್ के लिए बराबर along with bringing blood pressure down you forget any number remember blood pressure must be around not exactly 130 by 80 or 132 by 78 132 by 82 so the magic number in the blood pressure is 130 by 80 magic number in the blood sugar is 100 you have try to maintain 100 before food 80 90 100 after food 120 140 so that is the magic number. What is the magic number for the cholesterol? 100. Make triglyceride say 120 130 if it is 100 très very good you maintain your LDL I told you 100 so 100 is the magic number in diabetes so therefore if you maintain your blood pressure well by giving those anti blood pressure drugs which are cardioprotective and the Reno is the adjective for kidney protective then you avoid the complications. I'll just take the name of the drug. I'm not advertising for any company. They are called ARBs. ARBs is the kidney protective drug. You know that also protected during the COVID times. It was a drug we used plenty in the COVID time and got lot of benefits. So this receptor blockers is very important. So I was just trying to impress on you that you have to take anti-diabetic drugs to control your glucose. If the lipids are high, to make it around 100 Tg and LDL, take anti-lipid, anti-fat drugs. If your blood pressure is high, doctor will try to give you medicine. Try to maintain is 130 by 80, around that 130 by 80. The last thing is that diabetes is a disease of complications. It makes the blood thick. Why blood becomes thick? It becomes thick because of fat. I will show you one day photograph. We have a machine in which from the blood we take out the lipids, fat. You show those machine is attached to a bottle and you see the bottle, it will be full of yellow dirty things, smelling very bad. That is called lipipheresis. By like we do dialysis, we take out all the lipids from the body by that machine. You are having that thing in the body all the time. If you take anti-lipid drugs, you can take out the lipid from your body. And finally, you keep your blood pressure under control, you keep your kidney function under control. At the same time, you take a drug which keeps the blood thin. Dear friends, you know the drug, aspirin. We know we call it clopidogrel, but it cannot be taken. I am repeating 100 times. Into 100, it should be taken only with doctor's advice because these drugs are double-edged sword. If you take the appropriately, it is very, very beneficial. It has been said it keeps the heart attacks away. But if you take it without supervision, without advice, without knowing how to take it, then it is very bad. And we don't give it for the primary prevention. We give it for the secondary prevention. Somebody who already has a heart attack, somebody has a kidney attack, somebody has a foot attack. We give this to prevent and save the heart, kidney and the feet. Last thing, most important thing, how do you preserve our feet? The best principle, take care of your feet as you take care of your face. I'll repeat again, take care of your feet as you take care of your face. Wash the feet, dry it with towel. You dry the waves of the feet which can get fungus infection. If you want, you can apply, if your feet is dry, sometimes diabetic feet are dry, you can apply some cream, best is coconut oil, just apply coconut oil. And it is, we do not advise to walk bare feet. In the house, in our families, we do not have, some families do not allow the walking with the slippers, but every family will allow if you have a separate pair of chappals for your house and separate pair of shoes for your going outside. So you should not walk bare feet. But what is worst is our religious practice of walking barefoot in the temples. No, in Pondicherry, people are listening to me. We have 3 seasons. What are 3 seasons? Hot, hotter, hottest. Now we are in the hotter season. In the May, June, it will be hottest. So the ground, the temples where they walk, when they go around on the sand, it is very, very hot. Dear friends, they develop blisters, they develop ulcers, and because of neuropathy in diabetes, they are not aware. That's why diabetes is called silent killer. I'm sure after this talk you will not call it side, because know it about it now. They get blisters, if they don't take that stage blister also, it can be cured. But if you do not take care, then this disease spreads. Every diabetic foot starts with a small breach in the skin. So the skin level chinna ulcer start aide. Ninge care poliana in the spread pote, whole leg it involves, and one has to chop off. So therefore, you must take care of the feet. Most important, never walk bare feet. Walk with the socks and the shoes. Buy the shoes in the evening. You know why? Because your shoe size is highest in the evening, because whole day you're walking, so there is edema, little bit swelling in the leg. If you buy shoes in the morning, then you find that the shoes will not fit you. The shoe is very tight. For diabetics, for not diabetics, I'm very sorry. For persons with diabetes, we advise that keep the shoes little loose, and the front of the shoes must be wide. It accommodates your fingers. Clear? You know the ladies, they put very pointed shoes and they develop foot ulcers. So you must have a broad front where the leg is well accommodated. Use a good, maybe cotton, best is cotton socks to protect your legs from friction with the shoes. Most important, if you have a feet which is senseless, you must consult your doctor very often. You know, there was a teacher of mine, Paul Brand, who practiced in Vellore in a place called Karigiri. And you know, he has contributed maximum for the leprosy foot. He said once in one of the meetings that pain is the gift of the God to mankind. I'll repeat again, pain is the gift of God to mankind. If pain is there, you take your feet away. Supposing you are going to touch the fire, this is fire. I'm taking my feet to the fire. Moment I feel the heat, I'll take it away. But unfortunately, when the diabetes get nerve damage, it's called insensate foot. Touch temperature pinprick, so they get burn their feet. So these diabetics, forget about these sensations. How can you bring back the sensations? By good diabetes control. Dear friends, the bottom line is good diabetes control. Keeping diabetes absolutely under the numbers I have told you is a paramount important. Before I finish, I'll tell you, it has been shown that if you control diabetes well, your eye effects will come down by 25%. Kidney disease will come down by 36%. Heart disease will come down by 36%. Your leg amputation will come down by 50%. So the buzzword is about the control. Dear friends, in countries like United Kingdom, where I spent a couple of years, dear friends, I'm not telling you to spend time, I'm telling you to let you know that today in the England, there is no diabetic eye disease. You know why? They have a program called screening. You know what is screening? Screening means you're looking for it. Those who are getting married, you are screening for brides or bridegrooms. Screening. You take many boys, many girls, you see, any site, matrimony, shadi.com, tamilshadi.com, whatever you screen them and find the best one. Now, in the eye screening means we have got cameras where we can take the photograph of the eyes, not this front of the eyes, we take the back of the eyes. The diabetes affects every part of the eye. It produces cataract, it produces glaucoma. But what is deadly, what is blinding is the back of the eye, retinopathy. This retinopathy can be caught by a camera which can take the photograph of the behind the eye. And they take the photograph, and the beginning of any eye affection, they give the treatment. And the treatment is very strict control of blood pressure, strict control of the blood pressure, and a magic treatment called photocoagulation. We do it here, we do it many parts of the Pondicherry. So by that, the blindness is totally eradicated. But dear friends, in India, we do not have yet complete eradicated blindness. So dear friends, what is most important is what we call, again a quote, to catch them young, to catch them early. You must screen, you must look for the complications early and catch them early. How do you catch them early? By screening. if you do the blood pressure measurement, if you do one ECG, if you do at least examination of the heart with the stethoscope, you examine the heart by the doctor by the stethoscope, you can catch any heart element early. How do you catch the fundus, the eye involvement early? If you do at least, we have something called fundoscopy. Every doctor has it. I have one. I have not brought it here, but I have in the other room. You just look at the inside the eye. You see behind the eye. You can catch them early. Or do a photography. It is very cheap. I mean, we are going to have it. It's very cheap. Do a photography and see the photography. For the kidney, you find out uppu neeru. Neerle salt irikilla. Salt, two types. Micro salt or macro. Micro means small, macro means big. If you start at the stage of micro salt, you can reverse it. If it goes to macro salt, from microalbuminuria, it goes to macroalbuminuria, you cannot reverse. Similarly, in the feet, you catch them at the point of not able to feel a filament. We have a filament called Sims-Weinstein. Don't get the name, SW filament. It is 1 rupee, it costs 1 rupee. Just to put it in the feet till it buckles. If it buckles and the person with diabetes is not feeling it, you have to reverse the neuropathy. So dear friends, it is like the story in the Bible, the story of the prodigal son. A son which is going astray. If you catch him early, the prodigal son can come back. But the prodigal son goes beyond certain point, you cannot bring him back. So for diabetes reversal, for diabetes complication reversal, for diabetes becoming totally free and complications not occurring, even if they occur, by taking care early, you can reverse it. That is called point of return and point of no return. My appeal to you, please try to help your doctor to catch these complications before the becomes late, early. That's called before point of no return. So by microalbuminuria, by fundoscopy, by heart examination, by foot examination in every visit, or looking at the SW filament sensation, you can catch the complication early and reverse it. And I must also tell you, diabetes is a holistic disease. So you must go to a hospital which has all the branches like cardiology, kidney disease, ultrasound, X-ray, neurologist, in addition to diabetologist, endocrinologist, and NMC Pondicherry is one such hospital. Dear friends, thank you very much for your patient listening. I'll come back again. For today, I'll take leave of you. Thank you very much for listening to me. Thank you very, very much. On behalf of NMC, I convey our sincere thanks and gratitude for being with us this afternoon, and we'll continue this program again and again. Thank you very much. Bye-bye.